الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. أنا دكتورة عز عمر الفاضل. هنواصل إن شاء الله في كورس بتاعنا Advanced Infection Prevention and Control Course Lecture 6 Operating Theater اللي هي غرف العمليات. This picture for a new operating theater room and this one for old operation theater room. دي غرفة عمليات قديمة old operation room. طبعا should not meet the standard because the material of the floor and the wall doesn't meet standard. هنجي نشوف standard operation theater how it should be. Okay, here we will talk about traffic flow in operating theater room اللي هو movement inside operating theater أو الحركة بتاعة السبلايز والبيرسونيل inside الثياتر surgical theater suit اللي هو في جناح العمليات. المفروض إنه الحركة تكون محدودة وتكون بضوابط معينة. Okay, we have three type of area: unrestricted area, semi-restricted area, and restricted area. Unrestricted area are those in which personnel may wear straight clothing and traffic is not limited. ودي هنا المنطقة الخارجية ممكن يكونوا لابسين فيها الملابس العادية مع ملابس العمليات والحركة فيها مقيدة. ودي بتشمل لي غرف الغيار changing room or rest room وبتشمل لي الكوريدورز. okay. Semi-restricted areas such as processing and storage area for instrument and supply as well as corridor leading to the restricted area of the surgical suit. Personnel must wear surgical attire and patient must wear gown and hair cover. Restricted area include operating room and clean core and scrub clean area. Sink, surgical attire and mask are required in this area. طيب operating department comprises restroom, changing room, teaching room, storage area, reception area and operating room. طيب اوكي هنتكلم secondly عن environment of the operating theater. And when we talk about environment, I mean the environment of theater consists of temperature, humidity, ventilation, instrument and the staff behavior. Operating room, they are three designated area for operating room: restricted operating room, semi-restricted sterilization room, recovery room, non-restricted corridors and administrative office. Theater construction wall should be one continuous surface, easy to clean and free of seams. The surface of all floor must not be porous but instead be suitably hard, will resist seamless, not conductive and easy to clean. طيب الوall والفلور should be free of porous وتكون from materials can resist cleaning and disinfectant substances, and also should not accumulate the microorganism and dust. Temperature and relative humidity. Temperature should be maintained between 68 Fahrenheit to 73 Fahrenheit اللي هي from 20 centigrade to 23 centigrade. قلنا temperature it should be comfortable from the medical staff and the patient and prevent the growth of microorganism within the operating room, suit and general work area. In sterile processing should be maintained. Humidity should be maintained from 30% to 60% within the pre-operative suit, including operating room, instrument processing area and sterilization area. A relative humidity of below 70% should be maintained in sterile storage area. Ventilation system should be designed so that airflow pattern will not allow air contaminants to enter clean area. Air should flow from area of positive pressure to area of negative pressure. And I mentioned later in the past lecture positive pressure to protect the patient from infection, so that the air flow from clean area to less clean area اللي هو من الاوبريتنج روم، لانه الانفايرمنت او الهواء بيكون clean وبيكون filtered from inside to outside when the door open. طيب freestanding fan humidifier or dehumidifier اللي هي الستاند المراوح الستاندي، الهيوميديفاير اللي هي أجهزة الرطوبة أجهزة التجفيف should not be used in operating room لأنه بتغير في اتجاه الهواء وممكن disrupt the airflow and result in contamination. Operating room ventilation is maintained at positive pressure with respect to the corridors and adjacent area because positive pressure prevents the airflow from less clean areas into more clean area. All air should be introduced from the ceiling and exhaust at the floor. وحتى inside ال operating theater room نفسها أنا عندي sterile area وعندي clean area. sterile area اللي هي البيت بتاع البيشن والميديكال انسترومنت الستيرايل. الكلين اريا الاريا اللي بيقفوا فيها الميديكال ستاف، وليس كلين اريا اللي هي باخد فيها الدست بين بتاعتي للميديكال ويست. طيب the care of patient during surgery require movement of patient personnel and material within the surgical suite. Planning and controlling this movement assist in the containment of contamination. ضبط الحركة، الباب يكون closed should be closed، والحركة تكون لأساسيات يعني في supply ناقص، في حاجة المفروض تطلع من from the theater to outside. اوكي حركة تكون مضبوطة او بضوابط معينة. طيب patient preparation for surgery pre-operative bathing، المفروض يكون في شاورينج او bathing في النايت والمورنينج of العملية. المفروض يكون في antiseptics at site of the injury. المفروض يكون في hair removal of necessary إذا كان ضروري. والبيست إنه يستخدم كليبرز اللي هو الماكينات بتاع الماكينة بتاعت الحلاقة، لأنه الأمواس بتعمل لي شنو small wounds، ودي ممكن تكون source of infection to avoid the microabrasion اللي هي small wounds. طيب skin antisepsis apply alcohol based antisepsis زي الكلورهكسيدين أو البوفيدون أيودين to the surgical site. اوكي page 3 patient optimization، المفروض أحضر البيشنت. طيب fasting المفروض typically from 6 to 8 hours from solids اللي هو من الطعام وساعتين من الووتر. Secondly, blood sugar control especially important for diabetic patient. Temperature control اللي هو control النورموثيرميا، والميديكيشن management. طيب hand hygiene there should be written infection prevention policies and procedure. Policies and procedure are reassessed at least annually according to state of federal requirement. At least one individual trained in hand hygiene is employed by or regularly available to the facility supply necessary for hand hygiene زي الصوب والكحول بيس hand rub والسينك والبراشرز كلها تكون متوفرة. The facility provides supplies necessarily for adherence to hand hygiene, soap, water, brushes, paper towels, alcohol-based hand rub, and ensure that they are readily accessible to healthcare personnel in patient care area. Healthcare personnel are educated regarding appropriate indications for hand washing with soap and water versus hand rubbing with alcohol-based hand rub. يكون في continuous education، 200 بعمل هاند راب 200 بعمل هاند ووش، والمفروض السبلايز تكون متوفرة و accessible at point of care. Okay, also there should be poster to how to make surgical scrub and step by step and my 5 moment when. Okay, cleaning, disinfection, and sterilization. Cleaning of operating theater must be done by well-trained personnel because it's a critical area where a patient undergo invasive procedure and a healthcare worker come in close contact with blood and other body fluids. لأنه في العمليات بتكون في blood splash، فالعاملين في الcleaning أو housekeeper should be full trained. Any blood contaminant item must be treated with 1-in-10 hypochlorite solution. Heavily soiled linen must be treated with 1% chlorine before washing. Cleaning staff must be of adequate number of cube with the workload. Proper disinfection must follow the labeling of items to be disinfected as critical, semi-critical, or non-critical, and the concentration of disinfection must be high for critical item, intermediate for semi-critical, and low for non-criticals. دي كلها instruction should be تكون written in guidelines and policies and should be in the operating theater department. بالنسبة للبلاد سبلاش أو انسكابات الدم بتكون برضو written in procedures in how to deal with a large blood splash و small blood splash والpercentage بتاعت الكلورين for disinfection. Personal protective equipment اللي هي PPE. Gloves are when anticipated direct contact with blood or body fluids, mucous membrane and intact skin, and other potential infectious material. It may be necessary to change glove during the care of single patient to prevent the cross contamination of body fluids. إذا كانت العملية مدتها طويلة أو إذا كان حصل heavily soiled gloves can be changed. On the same patient, glove must not be washed for subsequent reuse because microorganisms cannot be removed reliably from glove surface and continued glove integrity can be ensured. When gloves are worn in combination with other PPE في sequence للدونينج and doffing، يعني sequence اللي بلبس أول منه والبطلعه آخر منه. Okay. When applying standard precaution, an isolation gown is worn only if contact with blood or body fluids is anticipated. وقلنا بكون في risk assessment للحاجات اللي أنا حلبسها before interaction with patients. Several gown size should be available in healthcare facility to ensure appropriate coverage for staff members. Isolation gown should be removed before leaving the patient care area to prevent possible contamination of the environment outside the patient room. طيب PPE دي أنا عندي حاجة اسمها risk assessment before patient interaction, healthcare interaction with the patient. في sequence للدونينج وفي sequence للدوفينج. الستبس بلبس أي واحد أول بطلع أي واحد آخر. Okay, surgical mask should be worn in circumstances where there are likely to be splash of blood, body fluids, secretion and excretion. Disposable masks are for single use only and should be discarded after 4 to 6 hours. They should not be stored in bags and reused, shared or hung around neck. If mask splash wet, it should be changed. A 95 respirator mask need to be chosen if there was an infection or communicable disease transmitted through airborne transmission. The cap should be disposable, waterproof cap of appropriate size which completely cover the hair. When finished from work, discard it properly in container for then wash hand immediately. Wear waterproof boot if needed or wear shoe cover over your personal shoe so as to cover your shoes adequately, and when finished remove it in the dustbin. Shoe cover should be disposable and waterproof boot should be washable. الwaterproof boot بتتلبس لما يكون في سبلاش لبلد بكميات كبيرة وبعدين إذا البيشن infected ب communicable diseases. طيب waste management sharp must not be passed directly from hand to hand. وبيستخدموا حاجة اسمها الكدني tray. okay. needle must not be recapped. ممنوع recapping. bent or disassembled after use. أفكها بعد ما استخدمها لأنه دي كلها بيخليك at risk of needle stick injury. use sharp must be discarded at point of use by the person generating the waste. all sharp container must be. طيب الشارب container عندها مواصفات معينة. conform to current national and international standard. positioned safely away from public area and at point of care. be secured to avoid splash. be temporarily closed when not in use. طيب management of soil waste. written policies, procedures and program on waste management should be in surgical suit and office. provision of color yellow bag. قلنا الكودين color system اللي هو اليلو bag for the infectious materials. الهايلي infectious material بستخدم لها الريد bag وبتكون فيهم البيوهازارد sample. should be not filled. 3-4 bag should be sealed or secured. Staff who regularly have to handle and transport waste must have provide with adequate protective equipment. training of staff to safe practice and how to deal with splash. storage area must be secured and not accessible to everyone, and the waste should be not more than 3 days on the situation. طيب occupational health اللي هو الصحة المهنية. eliminate the risk hazard. for example, reduce the number of injection by providing more oral medication. use safety needles, single-use needles. train staff regularly in safe working condition. establish occupational safety committee in a small hospital. This committee can double as the infection control committee. provide a free vaccine to all healthcare workers. set out clear policy for managing stick injuries. هنجي للoccupation إن شاء الله بالتفصيل. safe injection practice. perform hand hygiene. hand wash with soap and water or by application of 60% alcohol-based hand rub. the predominant use ethyl alcohol or ethanol or isopropanol hand sanitizer. use aseptic technique in all aspects of parenteral medication administration. medication vials use injection and glucose monitoring procedures. store and prepare medication and supplies in clean area. never store needle and syringes unwrapped because sterility cannot be ensured. طيب الاسبتيك تكنيك اللي هو الهاند تكون نظيفة أو معقمة والفايلز قبل ما أدخل السيرينج فيها أعمل لها disinfection. discard all opened vials IV solution and prepared or open syringe when not in use. avoid contact sterile drug and sterile area of devices and container with non-sterile object. the rubber spectrum on medication vial is not disinfected with alcohol prior to piercing. never use syringe for more than one patient. discard syringe needles and cannula after use directly on safety on dust bin or on medical waste dust bin. dispose of used needles. طيب عندي many types of infection control checklist on operating theater. عندي pre-operative patient preparation checklist. verify patient identity and consent. ensure antiseptic shower and razoring if needed. administer prophylactic antibiotic within 60 minutes and check fasting status and blood sugar control. طيب دي التشيك ليست الأولى المفروض it should be within ال OR وبتكون في الفايل في النيرس المسؤولة من البيشن. طيب in the other checklist like secondly surgical site and equipment sterility checklist. disinfect surgical site with chlorhexidine or povidone iodine, confirm sterile draping of patient, verify sterilization of instrument and trays, ensure sterile glove gown and mask are worn, check integrity of sterile packaging before use. 3 environmental and OR setup checklist برضو في check up تشيك ليست للانفايرمنت temperature والهيوميديتي والبوزيتيف بريشر والهيبا فلتر functioning well يعني. والمفروض انه الاير تشينج بير اور برضو more than 20 air change per hour. sharp container available at point of use. دي كلها للانفايرمنت. 4 عندي injection and medication safety checklist. Disinfect vial spectrum with alcohol before piercing. Use single-use syringe and needles. Never use. Discard open vials, IV solution and syringe after emergency. Dispose of sharp immediately in approved container. Post-operative infection control checklist. Ensure wound dressing is sterile and secured. Monitor patient temperature and signs of infection. Document antibiotic administration and surgical site care. Confirm disposal of all contaminated material and record or cleaning and disinfection after procedure. دي كلها checklist should be within an operating room بتكون في البيشنت فايل. طيب إذا أنا طبقت الحاجات دي حكون ضامنة إنه إن شاء الله الwound not infected. أوكي يعني بنسبة كبيرة، لأنه إحنا بنقول الانفكشن كنترول، الانفكشن هي preventable، الانفكشن هي preventable، يعني معظم النوزوكومين انفكشن دي هي preventable، أو 2/3 of الانفكشن في الهوسبيتال هي preventable. فإذا أنا طبقت الميجرز infection control measures دي well it will be شنو prevented إن شاء الله. طيب infection control is responsibility of everyone. Thank you very much. If you got accidental needle stick, stop working immediately. Rinse with running tap water. Don't rub, don't disinfect. Write incident report and then seek medical consultation.